Julie.
Alrighty, we all know breastfeeding is great for babies. It just is, and like I say, we all know that. But has the pressure to do it become counterproductive for some mums? The World Health Organization says infants should be exclusively breastfed until 6 months. And a recent medical journal article says doing so could save the lives of more than 800,000 children globally. But despite the overwhelming pressure, fewer than 20% of New Zealand mums hit the target. And according to children's health expert, Dr. Julie Bhosale, that comes with its own raft of health problems. She joins me now. Julie, good morning to you.
Good morning, Paul.
Thanks very much for joining us as well. There has for a long time now been a huge amount of pressure on new mums to breastfeed, hasn't there?
Yes, there has.
And it's right, isn't it, that there is good reason for that because we know for a fact it is best for the baby.
Yes, absolutely. Breast milk is nutritionally best for the baby, but for some mums that doesn't actually mean that breastfeeding is the best choice for them, particularly when their mental health is at play.
Okay, because another thing that's very good for the baby is the relationship between the mother and the child, and the mental health of the mother is vitally important.
Absolutely. In fact, the bonding between a mother and their baby is the most important.
Why is it that only around 20% of New Zealand mothers manage to breastfeed for the first 6 months exclusively?
Yeah, well, there is a multitude of reasons why women struggle, including not being able to produce breast milk in the first place, to babies having some physiological challenges such as tongue tie, to women actually struggling to latch in the first place or a very painful latch, and then, of course, the logistics of actually returning to work.
But we are not as good at it in the developed world as those in the underdeveloped world, are we?
No, in fact, countries in higher socioeconomic status actually don't achieve that breastfeeding exclusively to 6 months as much.
Is that partly because there are a range of other pressures on women in countries like New Zealand than there are in some other countries?
Yes, there is, and the work factor really, really comes into play because, of course, women are in the labour force a lot more than traditionally. I mean, in the last 10 years, there's been a 10% increase in women actually in the workforce, so that's going to have a flow-on effect in terms of how you're going to breastfeed your baby.
Now, I know one of your big concerns is the mental health of mothers who are put under extreme pressure by, so say, experts. Well, no, they are experts, not so say, they are experts, to breastfeed. And they are almost, in many cases, condemned for not being able to do it. To what extent does that manifest?
Well, postnatal depression affects 15% of all women, and that statistic is actually likely to be underreported because, of course, women aren't going to admit to that. And having trouble when you breastfeed or experiencing pain when you breastfeed places women at an increased risk of that postnatal depression.
Do you know to what extent? Do we know to what extent?
It's based on a very, very high risk factor. I mean, women in the postnatal period are at the most risk of depression in the first place. So anything that's going to stimulate that is only going to bump that up even higher.
What are some of the specific pressures on women to breastfeed? Because I've heard that there are hospitals that actually hide the bottles, that have the bottles locked away.
Yes.
Such as the pressure that women are told, no, that is not, you don't have a bottle, you organise yourself.
Yes, absolutely. Well, I can actually speak from my own experience there because I had huge trouble breastfeeding both my children. I experienced very, very severe pain, and to the point where my mastitis was so bad, I was a day away from having surgery, and I was very
and yet
much...
still you were put under pressure by experts to breastfeed?
To keep going, yes. And I felt like if I just tried harder, even though it was actually the point when my baby was basically drinking blood, I would just be able to keep going.
So basically you were led to believe that this was all your fault and you should just make more effort.
That was definitely the pressure. And, it was self-inflicted as well, especially being an expert in the area. I sort of thought, well, if I teach breastfeeding...
If I can't do it, who can?
Yeah, surely I should be able
midwives?
to.
Midwives who, many people say, oh, you don't criticise a midwife, but are midwives accepting of the fact that for some women it's just not going to be possible?
I think it's very difficult for midwives because obviously their hands are tied in terms of, we are needing to encourage women to breastfeed and, up to that 6 month period. But I think, this is 2016. Women really need to be empowered with choices around that.
Okay, so what you would say as an expert in this area is that women should be given choice. They shouldn't be made to feel like failures.
No. We do need choices because it just may not be what's best for mum and baby.
Okay, so I can imagine there will be midwives who are listening to this and watching this thinking, if I give choices to my people, they will take the choices, they won't even try. Is that a real worry?
Of course it is, but the message needs to be around the mums and what is best for them with their mental health, because of course if that's at risk, then there is going to be no bonding with their baby.
Exactly. And the biggest risk is that you don't have that bonding, you don't have that brilliant relationship.
Absolutely.
Fantastic. Julie, thank you so much for joining us.